Welcome. Today, we're taking a closer look at wound dressing, what it is, why it matters, how to do it right. Whether you're a healthcare student, a caregiver, or just someone who wants to be prepared, this guide will give you the essentials. What is wound dressing? Wound dressing is the process of covering a wound with a sterile material to protect it, promote healing, and prevent infection. It's one of the simplest yet most important steps in basic medical care. Why dress a wound? Here's why wound dressing is so crucial. It creates a protective barrier against bacteria. It absorbs fluids that leak from the wound, also called exudate. It keeps the wound moist, which actually helps it heal faster. It can relieve pain and keep the wound from drying out or cracking. And of course, it protects the area from further injury. So what makes a good dressing? An ideal wound dressing should be sterile, non-toxic, non-allergenic, moisture retaining, easy to apply and to remove, and gentle enough not to damage new tissue. It also helps if it's affordable and easy to find. Types of wound dressings. Now let's talk about the different kinds of dressings you might use. Gauze dressings. Simple, breathable, and absorbent. Great for light wounds. Film dressings. Thin and transparent, letting you monitor the wound while keeping the bacteria out. Foam dressings. Soft, cushiony, and super absorbent. It's ideal for wounds with moderate to heavy exudate. Hydrocolloid dressings. These create a gel over the wound, locking in moisture. Hydrogel dressings, however, used for dry or painful wounds. They cool, soothe, and hydrate. Each type has its place depending on the wound size, depth, and drainage level. Antiseptics. What to use and what to avoid. Now let's clear something up. Not all disinfectants are safe for wounds. Safe options include povidone iodine or betadine. Effective but may irritate sensitive skin. Chlorhexidine, widely used in hospitals and very effective. Hydrogen peroxide can be used sparingly but may damage new tissue if overused. But here is what to avoid. Alcohol. It stings and kills healthy tissue. Undiluted Dettol. It's too strong and can cause irritation or chemical burns. If you do use Dettol, make sure it's diluted, at least 1 part Dettol to 20 parts of water. When in doubt, sterile saline is always a safe option. How to dress a wound step by step. First of all, wash your hands. Use gloves if available. Clean the wound gently using sterile saline or an appropriate antiseptic. 3. Pat the area dry with sterile gauze. Apply the right type of dressing. Then secure it without applying too much pressure. Change the dressing regularly and monitor for any signs of infection. So what are the warning signs of infection? Increased redness or swelling, pus or unusual discharge, a bad odor or smell, some fevers or chills on the patient, pain that's getting worse, not better, or perhaps warmth and tenderness around the wound. Eventually, taking care of a wound may seem simple, but doing it right can make all the difference in recovery. Using the right dressing, cleaning it properly, and watch out for any signs of infection.